So how do we get there? How do we come up with goals? I know you have mentioned a term called working backwards.
Mm-hmm.
Explain to me what working backwards is. Let's talk about that.
I just
What
made it
age
up.
group do you what age group do you work backwards? Is that something you do with adults, or you start that with little kids?
Oh, I start that with everybody.
Okay.
I mean, I guess the more common way that this gets expressed is begin with the end in mind.
Okay.
And for me, and probably for you, because of where we started, thinking about what happens when this person grows into a full grown adult.
Mhm.
What are the skills that they are going to need? Really thinking about where are they going in this life? What's
Mhm.
going to keep them safe? What's going
Mhm.
to make them be happy in their life? And what's going to make their life structured in a way? I mean, you have to get along with others.
Right.
And no matter what, you're probably going to be sharing space with other people. So
Mhm.
it's not just what do you want? I think in the beginning when we had person-centered planning, a lot of times it was criticized because it was all about, hey, what are your dreams? We're going to make them come true for you. Oh, you want to be a Major League Baseball player? Great.
Mhm.
And we lost a lot of people with that.
Yeah.
But when you take it back and you look at it in a broader way, where is this person going to live? Who are they going to live with? What kind of job are they going to have? Um, and by the way, how many jobs have you had in your life? Do you have to pigeonhole into one and only train for one? Can you switch around? Um,
Right.
those sort of things. But then looking about things like loneliness, relationships, understanding another person's point of view. These are all very complex skill sets. And
Mhm.
so, whether I'm starting with someone who is a teenager and we're doing that transition planning for the IEP, what are the skills that are going to prevent you from being successful if you want to work at the grocery store? Well, you
Right.
can't read the labels, you can't match the labels, you don't know how to greet people appropriately yet. Whatever those things are,
Yeah.
we're pulling from that. But if we're talking about a 2 or 3 year old, we don't know all that yet. But
Right.
we can look and we can see things like in the developmental checklists, what are they missing? And fill those things in so that they have as many of those lower skills as they possibly can have. Because if they miss those, then it's very hard to go back and recapture that and build upon them later.
Right. And I think that that's what I have seen over the course of my entire 25-year career is that so many skills are often and frequently skipped over. And they don't
Exactly.
have those basic skills that they need. But also with those little kids, those conversations can sometimes be tough to have with
Sure.
parents.
Mhm.
Um, and not knowing, like you said, we don't know what the outcome is going to be. We can predict, we can guess what the outcome is going to be. We've been doing this a long time, but having those conversations with those parents can often be very, very difficult,
Yeah.
um, depending on what the situation is. So,
Yeah. It can be. And there's a process. And sometimes the parent isn't ready to move forward yet.
right,
But at the same time, you can still be giving parents some suggestions on skills to develop in their child,
hmm,
even if they're not ready to hear this is the diagnosis, this is the severity, all of that. They still, most of the time, want to teach their child.
right.
And
They
so,
want them to learn. They want them to progress. They want to see what can, what are they going to be?
yeah,
I'm a mom, you're a mom, and we all want to know when they're born, what are they going to be when they grow up? And
yeah.
having that diagnosis, whatever it may be. And those skills can sometimes be very difficult.